Yes.
You can go ahead and get started with your presentation.
Great. We are applying for direct appropriation funds for the first time for Faith Family Medical Center. We are a nonprofit medical clinic for the working uninsured. It fits a specific niche in Nashville because our patients cannot afford health care insurance, but yet they don't qualify for the other services that might be provided. We've been around since 2001, and over the years have served over 30,000 Middle Tennessee residents. And I do want to point out quickly at the beginning, I had this edited the day I was off, and it was submitted by my supervisor. And in question 1, it has the wrong number of, she put the number for all of Middle Tennessee and not just Davidson County. So I wanted to correct that to be 1,761 Davidson County residents, and the encounters is 7,098. I think it was just a misunderstanding. And I wanted to 098. I wanted to set that straight up front. It doesn't affect the number of patients that we are requesting care for, but it does, it's not correct. It doesn't reflect Davidson County. So over the years, we have been able to make a network of physician specialists in our area. We're right down by St. Thomas Midtown. We are able to refer our patients to orthopedists or oncology or surgeons, whatever they may need, and we negotiate with those physicians. They've agreed to help make this affordable for the patients who might not be able to do it otherwise. So it does benefit Metro in the way that we are saving Metro money through less ER utilization as primary care. And overall, as I said in the proposal when we answered the questions, healthier Nashville is just better for everyone. Often people that are self-employed or working 2 jobs do not have health insurance. We've actually learned many nonprofits here aren't big enough to provide health insurance to their employees. So we have really tried to get awareness up, spread the message about who we are and what we do. We're very fortunate that we have been broadly supported in Nashville over the past 17 to 18 years. And we started in 2001, so a long time around. We are proud of the fact that we are able to offer compassionate care to working Nashvillians who seem to just fall through the cracks often. We do have a little bit of money from a Tennessee safety net grant to help these patients, and the funding that we're requesting would help offset the additional costs that's required. Patients do pay on a sliding scale, so it depends on their income and their family size. Some of the people, depending on family size, can go up to 400% of poverty level and still receive care. And we work with our patients to make sure that if they meet other requirements, we help them get insurance if possible. We have a navigator that comes, even though the funding has been reduced, she volunteered her time to come during open enrollment and help our patients. So we feel like we're trying to do a comprehensive plan that includes primary care. Our wellness program, too, is very unique. We do that at no cost to our patients, and we have a dietitian who helps with the patients who need to know about nutrition, how to cook healthily, how to exercise if you've never exercised before, just all the tools that are needed to start on a better path. We all know that healthcare is an important component, but also trying to improve the outcomes and improve their health overall is a big thing for us. In fact, today we have one of our 10 chronic disease days happening at the clinic, where people that are diabetic or at risk for diabetes can come and get 5 different specialists: podiatrist, dental, ophthalmology. Lipscomb Pharmacy does a medication review for us. They can get multiple services at no cost in one visit and not have to miss more days of work for multiple appointments. And we find that is helpful because it enables the patient, number one, to not be off work as much, but also they get to come into the wellness program, meet with our dietitian, and often will begin an exercise program after that. We are glad that many of our patients ask for that to be including their families. And we stated in the proposal as well that, once the family is involved, the future of that family is much brighter. We've had patients come in and want their children to eat better. For many people on a limited budget, they don't know how to make healthy choices in the grocery store. Often fast food is less expensive. We do have a community garden that we utilize when the weather's good to help our patients understand how to use fresh vegetables, what healthy menus look like, and it's been really a blessing to the families to be able to have that provided at no extra cost. So we really feel like we're sort of a wraparound comprehensive care program that's unique to other charitable clinics in Nashville. We do partner with the other charitable clinics and refer back and forth if we need to. We're part of the Tennessee Charitable Care Network, so we do utilize those groups to help affect policy, Hill Days, and things like that, to try to make sure that we are up to date on the different resources and options that are available in this particular niche with healthcare for the working uninsured. We would love to have support of Metro. We do feel like we save Metro money and we help Nashville be a healthier and better place overall through the way that we help these patients. We've had patients that have been with us since the beginning, since 2001, which is sort of amazing in a way. And when they turn 65, we help them get on Medicare as well. So we are proud of what we do, and that we do feel like this is an area, even though healthcare has been up and down nationally, we have found that we're going to be needed and the services are going to be needed probably no matter what the Affordable Care Act or group health care or any of that looks like, because there's always people that just don't seem to fit that niche. We did expand our services slightly to help the underinsured. We do have found that there's people that got on the exchange programs and their deductibles were so high that they could not meet those. So we do work with those type patients if they meet the criteria to help them get health care as well. Because if you have a $10,000 deductible, it's great if it's, I hate to say it's great, God forbid, you have to use it all if there was a tragic accident. But for routine health care and preventative health care, often those patients forego that because they really just can't afford the deductibles. So I'd be happy to answer any questions. We do a lot in a small clinic for a lot of people. We are in Middle Tennessee, although 68% of our patients are from Davidson County. We love our location because of public transportation access and the access to the referral network that we've built. I think I mentioned the Lipscomb Pharmacy. We provide medications for $5 for 3 months supply through the Prescription Assistance Program. And the Lipscomb Pharmacy program manages that for us. In addition, we are able to provide colonoscopies and mammograms free or at a very reduced cost to some of our other partnerships. And we really can help people 18 to 64. So we do hit a broad group of people who, and we really see that. We see it, even though most of our patients probably are 35 to 64, we do see the younger people with Nashville growing the way it is coming in more. We did win an award with the community Center for Nonprofit Management, the New Generations Award, year before last, for our work in that area. We really tried to get the message out to that group as Nashville's grown and changed. So,
Okay, I have a couple questions.
Yes.
One, because I'm not familiar with your organization.
Mm-hmm.
How do people find you?
that is a great question. We do have people that refer to us. We have a partnership with the Meharry Vanderbilt Alliance, and they refer to us. Physicians can refer to us. We do have a marketing budget that we work to advertise. It's an interesting situation because we do fundraise. So we want to capture our patient demographic and our donor demographic, but we do target social media, some paid advertising. We did last year with the Tennessee Tribune. We've done different ways that we're reaching out to community centers in Nashville. We work with the United Way. We work with Siloam. We work with United Healthcare, the other charitable networks and charitable clinics in Nashville. Because everybody's sort of got a different niche that they fill, which is why we can all be here in that space. But I do think getting the word out and public awareness is one of our biggest challenges. We continue to find new and different ways to reach that audience.
And my next question had to be, how many employees do you have versus volunteers?
That is a great question. We have 20 and one part-time, so 21 total staff. Some of the providers, nurse practitioners, and physician's assistants do not work every day. Some of them work 4 days, and our psychiatric nurse practitioner doesn't work every day. But we do utilize volunteers in the clinic, which does help us a lot as far as our budget goes. I would say there's maybe a pool of 20 physicians. Some are still working, some are retired, that volunteer. Some come once a week. Our retired medical director comes on Mondays. Some come once a month. We have a neurosurgeon recently retired. And you think, well, how's that going to help in a primary care clinic? And it's ended up that he's seen a lot of patients that have those kind of needs, and we can refer them to one of our orthopedist or neurosurgeon partners if they need additional care beyond that. So we have got a wide range of volunteers who help keep our costs down and enable us to see people. We have volunteer dentists that come in on Friday. We do work with Interfaith, but they're more transformative dental care, and this is preventive maintenance for our existing clients. They come in on Fridays and volunteer to see our patients. And then on these chronic disease days, we have ophthalmologists, podiatrists, think about all the different areas that look at the diabetes. Your eyes, your feet, your teeth, all the things that diabetics need to look at, they volunteer their time as well. So there a lot. We have a big volunteer network, and we utilize medical assistant volunteers and nurse volunteers as well. Some have been with us a long time, and some are new. We're also fortunate that we get a lot of interns that need hours, and those help as well. And medical assistants in Tennessee do not have to go to a school to do that. So if you have a go-getter intern who possibly is in college thinking about the healthcare field, they could actually learn to do that over the summer. And we've actually worked with some interns and trained them to be medical assistants. One of them is staying for a whole year through the Nashville Fellows Program. And she's thinking about something in the healthcare field.
Okay. I've got one more question, and I'll let you guys do it. I'm interested in any partnerships you may have with metro agencies.
Mm-hmm.
A little bit, I mean, you've got General Hospital, you've got the Department of Public Health, you mentioned a community garden, which would be a link to farmers market because of the work they do. Do you have established relationships
Yes.
with those organizations?
Yes, we do. We work a lot with Matthew Walker. We try to find the best place for our patients, and sometimes they need to go somewhere besides us. Since we've been around for so long, we have long-time relationships with all of the public health entities and the people that are policymakers as well. I think the person that has just been appointed in the new governor's cabinet is, I can't remember his name, sorry, that escaped me, but it's someone that works very much with charitable clinics and understands how the safety net consortium works, because those clinics all talk to each other and share resources, the Meharry Vanderbilt Alliance, how that works, and how we help save money, the state and local, by the work that we do. And the private hospitals as well.
We're running out of time, you folks, I'm sorry.
Oh, no, sorry, I could talk
No,
about
I'm
it all
looking
day.
at them. I'm
What's
sorry.
your annual operating budget?
$2.1 million. And fundraising right now is at 1.6 million of that. So the patient fees.
Okay,
and
$29.
the average is $29 with a sliding scale. It could be as low as, I think the lowest is probably $15. And, it's, for many, many patients, we work hard to figure out what's the best thing for them regardless of their circumstances. So if they're established and they lose their job, we won't send them away. So we try to keep them as patients as long as we can, as long as they need us. But if they can get insurance, we also want them to have the best thing for them as well.
So I think you answered it, but you're not a federally qualified health center, right?
No, we're not. We never have been that, and I think it was a conscious choice by the founders to enable a little bit more latitude as far as, it is Faith Families in our name.
Yep.
We don't try to convert anyone to a faith, but we feel like we're motivated by what we do by our faith, and if our patients so desire, we're happy to make sure that their spiritual well-being is covered as much as anything else. So I think it allowed the founders felt like it allowed a little more freedom to not have federal funding.
So that means no direct TennCare funding?
No.
Okay. All right.
The Tennessee, the safety net funding is the only government money we get.
Okay, thank you very much.
Thank y'all.
Thank you.
Sorry, I talk a lot. Talk
No,
fast.
you're good. You're good. You're right on time. Thank
Yes.
you.
Thank you.